When your child is sick, you want them treated as quickly as possible. What if you could give them the medical care they need before they were even born? This approach is called fetal surgery, and for some expecting parents, it's a safe and effective way to care for congenital conditions. One example is spina bifida, a defect in the spine. In its most complex form, called myelomeningocele, it can affect your baby's ability to control their legs. In the past, this condition could be diagnosed during pregnancy, but only treated after the baby's birth. However, recent innovations in surgical techniques have enabled specially trained pediatric surgeons to close the spinal defect on the developing fetus within the womb. This type of early intervention leads to better results for the baby, including improving their chances of walking independently. Fetal surgery is also an option for conditions like congenital diaphragmatic hernia, congenital high airway obstruction syndrome, and more. These procedures encompass a wide range of techniques, most of which are minimally invasive. Like any surgical procedure, fetal surgery does carry risk of complications to both the mother and the baby. It is crucial for families to discuss with their doctor prior to surgery. By working across multiple disciplines with diverse teams of specialists, our pediatric program has a proven track record performing complex fetal surgeries. If you or a loved one want to learn more about what we can offer, our team is here to help.